All right, we are here for a very special treat. I get a ton of questions almost daily regarding gynecomastia, combating it. What are the different options out there? And as I said in previous videos, I have a very good friend of mine for over 20 years now, who is the master of this particular issue. And he's been doing it for almost 30 years now. And you're an old man.
I'm old enough.
Yeah. And he's a wealth of knowledge, so I figured instead of me just babbling about it, I would come to the source. And yes, he helped me in 2010. And, I was devastated, like most of you out there who end up with this issue. It is... man, it's a nightmare. It is a nightmare emotionally and physically. It can be painful and it looks terrible, particularly if you're getting on stage and it can make or break you on stage. So without further ado, this is Dr. Rick Silverman. We're here in Newton, Massachusetts in his office. And why don't you tell us where you came from, when you started,
Sure.
What you do?
Well, I've been doing plastic surgery. I started my training in 1990 at UMass in Worcester, and I spent a couple years training there, and then a third year spending 6 months as junior staff and 6 months doing a traveling fellowship, at which time I went over to Taiwan and Australia to do a microsurgery fellowship. I don't do too much microsurgery anymore here in Boston, but during the fall of '92, one of my friends, Jimmy Broderick, who referred me my very first bodybuilding patient with gynecomastia, sent someone in, and then I saw another one and another one after that, and the next thing you know, I'm the gynecomastia guy. So it was really one of the first things that was ever referred to me as a practicing plastic surgeon, and then over the course of time, I started getting involved with bodybuilding directly as a competitor, and did my first shows in '96. Back, I met you around that time, yeah. I think, and Mike D'Angelo and a few other local folks. And one thing led to the next. It kind of fed itself and kept growing, and now I find myself specializing in gynecomastia and dealing in general with patients who are involved in fitness and bodybuilding, and doing all sorts of body contouring procedures, but mostly gynecomastia.
So what a huge awesome blend, because you were a bodybuilder yourself and became made so many friendships through the years that it was only natural you became the go-to gyno guy.
Yeah.
As well as breast augmentations.
Right.
So your client list is a who's who of everyone. We won't get into who, but you've had just about everyone in your office under your scalpel, and obviously you do women and men, and I know of a ton of them because I've sent you a ton of them, and you do a tremendous job. I never had any recurrence whatsoever. What is the percentage of recurrence?
Recurrence is low. I mean, if the procedure is done correctly and the majority of the tissue is removed, even if someone uses something again, if they take appropriate precautions, they can potentially prevent it from coming back. I've seen a few patients where they've had recurrence where it's described as recurrence, but it's probably really that it was never fully resected in the first place, which is a problem when you see someone who doesn't do a lot of gynecomastia surgery. The other thing that happens oftentimes, and we can get into more details, but sometimes patients will develop some scar tissue under the nipple after the surgery, and if they go on to a cycle within the first 6 months or something, the first thing they might think is that it's coming back when it's really just scar tissue. So,
right. I had a friend I brought to you who he wasn't having a recurrence of any sort, but he was having hematoma issues, and that's something that can also arise.
Yeah,
as well.
He had a little mass on one side as a result of a hematoma from his original surgery. And actually, I resected it, and he still got a second small little hematoma that we were able to manage pretty readily without problems. And I think he's improved. I don't know that it's 100% because I haven't seen him back here.
Yeah, I think that's more of a medical issue within that personal individual. But so when you say removing a little of it or a percentage of it, how how do you know how much to remove? Certain doctors are going to do a different thing.
Sure.
Certain will take it out, and then that can risk leaving like an indent in there.
Right. One of the biggest fears of any patient, bodybuilder or otherwise, if they've done their research, they'll come across the term crater deformity.
Right.
And a crater deformity is when there's too much tissue resected from underneath the nipple, too much taken out from under the nipple, and the rest of the tissue isn't adequately contoured, which typically we do with liposuction. If that happens, then they may have this hollow look under the breast, under the nipple, even with their arms down. It's not uncommon to see a little bit of flattening of the lower chest after the surgery with arms raised because you've removed tissue that would normally give a little bit of prominence there. So that's normal, and of course when you're competing and you have your arms up over your head for abs and thighs or something like that, it looks fine because you're lean. But if you're not lean and you're walking around with a deficiency of tissue in there, it's going to look like you either have a donut around your nipple or just it's going to look flatter or depressed. So people go into that with that fear of having a crater deformity, and plastic surgeons have the fear of creating that problem. And so if you go to someone who doesn't do a lot of gynecomastia but knows that they could create this problem, they will have a tendency to potentially under-remove the gynecomastia. And those are patients that I see back as recurrences who really just didn't have the original...
They weren't people you saw to begin with.
They weren't people that I saw. No, I mean, in my hands, if I think back to real recurrences, I can come up with a few. I mean, early in my practice, I had a fellow who was a power lifter. I did his procedure. He wasn't super lean, so I had to, contour him appropriately. And then about a year and a half afterwards, sure enough, he went on another cycle of testosterone, and on one side it came back. Removing it was a smaller procedure that time in his case, and oftentimes it's smaller. I have another patient who had his gynecomastia originally from steroid use, and about 2 years after that he came back with a recurrence on one side that was more than his original gynecomastia, and it was specifically related to a product at the time from Gaspari. We couldn't figure out what he had used, and it was a product that was a NO2 product with creatine in it, and my guess is that it was spiked with something else good inside it. And sure enough, what I tell patients who use any kind of testosterone booster supplements is to watch out for the term proprietary blend, because sometimes they'll put things in there that you're not really sure what they are. And if it's a hormonally active substance and you're someone who's sensitive to it, you could get in trouble for that. Then it could come back. And this guy had a recurrence that was, it was like a hamburger. And I took it out in the office, but
that's interesting.
You don't like to have to go back to the operating room. I try to keep the cost down.
So. Now, speaking of cost, this procedure still is not covered by insurance.
Yeah, generally speaking, it's not covered. I mean, insurances have gone in the direction of trying to avoid paying for anything that they can pay for.
Of course.
Except for their administrators and
So why are they saying this shouldn't be paid for?
With gynecomastia, in theory, it's a cosmetic procedure. There's no medical reason to have it taken care of.
Now, let me interrupt real quick. When I had it, it was severely painful. If I slept on my stomach, it was painful. If I bumped into it, it was painful. If I was on the beach, it was emotionally painful.
Right.
For people to come up and want to suckle me,
Yeah.
That to me seems like it should be taken care of.
One would think, right? But I'll tell you, for 25 years, longer than 25 years I've been doing this, there were times when it got covered more readily than now. But even since I started doing it, I remember a 13-year-old patient who was sent to me by one of the primary care doctors in Worcester, and it came with his mother. He'd had it. It was gynecomastia related to puberty, and that's common. And, I figured he's sent in by his primary care doctor, we'll submit it, and so on and so forth. And he got denied. So I contacted the insurance. And this is 1994, 1995. Things were covered a little bit better than they are now. And I contacted the insurance company, and I said, why do you even send these patients in? Well, we'll send and pay for the consultation, but it's a cosmetic procedure. I'm like, well, why do you get the hopes up on these young kids if they can't do it? What is your indication? What are you going to pay for? And they said, oh, if you think it's cancer. So basically, what insurance will pay for is a breast biopsy. Mm-hmm. What that's resulted in my practice is I stopped taking insurance for gynecomastia procedures a few years ago, because the last time I took it, I had 2 patients that were approved, one of whom I never got paid for.
Right.
And the other one I got paid $760.
For a biopsy.
Basically, that's what they pay you for a biopsy.
Okay.
So.
Well, that's disturbing to me.
Yeah.
I bet their defense also is it's a self-inflicted thing.
Well, but puberty is not self-inflicted.
Exactly.
And kids sometimes have pain with it. Other patients have to take medication that causes it, and there again, if they have pain, you would think it would be covered. I think the rationale that they make to not cover it even in instances of pain is it's not guaranteed to get rid of the pain. Now, I found that 98%, I can't even think of anyone who didn't get rid of their pain. I have patients who had pain afterwards, and that's a different issue. They had some nipple sensitivity and whatnot, and we've had to deal with that. That's rare, but it happens occasionally. But for the most part, the patients who had pain going into it didn't have pain afterwards. And that's not a surprise. There's a branch, it's the deep branch of the 4th intercostal nerve, in other words, the nerve that comes out from under the 4th rib, and we preserve that nerve in women when we do breast reduction to maintain nipple sensitivity. In gynecomastia patients, that nerve's going to get cut. So that's going to take away a certain type of sensitivity to the nipple, and oftentimes gets rid of the pain. But it's not a guarantee. It's not a guarantee. So that's what their argument would be, I'm guessing.
I don't really care about the nipple sensitivity.
The interesting thing with men is, a few years ago I presented a paper at one of my international meetings about the erotic sensibility of the male nipple. And in gynecomastia patients, at least in my experience, talking to, somewhere around 900 some patients over the years, I've had a few that complained that their nipples were not as sensitive afterwards. Interestingly, in the world literature, it's estimated that, at least one paper I came across was about 50+% of men derive erotic pleasure from nipple stimulation. Not if they have gynecomastia. Those people, I think, just avoid having anyone near their chest.
Yeah, that's me.
So most guys,
that's the worst. That was one of the issues. Some would be a wise ass and pinch you. That is like a war. I'm ready to full blows if you touch my nipples, particularly when there was a tadpole in there.
Yeah, exactly.
That was terrible.
Common things that I get asked, is, what caused it and why, and so a lot of times, if it's someone who did get it from a performance enhancing agent or a testosterone boost or a supplement that they bought thinking it would be fine, they may go in fairly naive and not really understand what was involved, and they're manipulating their hormones, and the result of that is that they can get gynecomastia. And the typical scenario is, someone starts on something, they may have a little nipple sensitivity, and then they do their cycle, and 6 or 8 weeks later when they finish their cycle and they go off, if they don't take appropriate precautions with a post-cycle treatment or whatever, they may get worsening pain and then feel a lump and whatnot. What I've observed in the last couple years, interestingly, is I think I have more patients getting gynecomastia related to prohormones and the over-the-counter things than to the real stuff. And my best guess is that guys who are using the real stuff are more informed, they're taking precautions and whatnot to try to avoid getting gynecomastia in the first place. Whereas someone who goes into GNC or their favorite supplement shop and says, give me something that's going to help me out, and they buy the thing behind the counter usually, it's not usually out available to everyone. They don't really know exactly what they're doing, and the guy selling it may or may not know what to tell them and advise them. Plus, it's not a real medication, so they don't have a guarantee that what it says it's going to do is exactly what it's going to do.
Right. Or that it is what it is.
Or that, and that's true for anyone getting any, parking lot purchased products.
So I have a friend who actually asked me the other day. He was a great high school football player, and he did just what you said. He went and bought the pro hormone.
Mm-hmm.
This was 15 years ago, and he's now in his late 20s, and he's got sensitivity. He's got some boobs, he thinks, you know. What would you tell? I told him he's going to come see you, but I told him to go on a diet, get as lean as possible, so you can see what he's working with, you know.
Sure.
If it's just fat, and it's going to be harder for not only you to diagnose but to treat it appropriately. So, what is the best way for people to approach?
Sure.
That?
If someone thinks that they have gynecomastia,
Alright, this is the Boston Mass. Thanks again for watching. Now, if you're not subscribing, subscribe now. Tell all your friends to subscribe. If you haven't, do it now. Alright?